Thank you, Mayor Lucille, and thank you, Brandy. First of all, I would like to do the land acknowledgement. I acknowledge that we are joining you live from Manor, Saskatchewan, Canada, on the traditional territories of Cree, Saltiaks, Dakota, Nakota, and Lakota peoples, the homeland of Métis. Ladies and gentlemen, this morning feels really fresh, unique, and it feels like this very moment is whispering me a new hope and the hope of improved, sustainable future for communities, and workers and families across the globe. A special thank you to our today's keynote speaker, Mr. Brian Lloyd, Executive Director, Ministry of Labour Relations and Workplace Safety within the Government of Saskatchewan, Canada. Thank you to IRIOSH Board, our volunteers with IRIOSH International Advisory Council, IAC, and the IAC Chairperson, Dr. Rafi, the gentleman behind the mission. Dash Director Dr. Halim from Malaysia, wherever you are, thank you. Always being the tremendous contributor. Distinguished speakers, professors, researchers, regulators, observers, NIRIOSH Malaysia, Malaysian Society for Occupational Safety and Health, AMSHOS, Indonesian Industry Hygiene Association, Korea Occupational Safety and Health Agency, Director General himself from Dash Philippines, the Malaysian Occupational Safety and Health Practitioners Association, APOSO, Professor Dr. Vincent Ho with the Asia Pacific Occupational Safety and Health in the house. So many public health officers, healthcare professionals, inspectors, public officers associated with the multiple ministries from multiple regions, nations, and enthusiastic graduate, postgraduate, professional participants joining from 14 regions and or nations, including Canada, Australia, Asian nations, and beyond, for joining us in this fight against the psychosocial issues, which is really the issue of sustainable communities and workplaces. Thank you from the bottom of my heart. Thank you on behalf of IRIOSH global community. I'm excited because it's inaugural as well as global forum, but also I'm a little nervous this morning because issues of psychosocial is one of the most sensitive topics and begs the extreme care and respect. I'll try my best to address it with a great responsibility and care. If anyone among us today in the audience who are silently struggling with this very issue, please know that I'm with you. IRIOSH is with you. If you feel lost, need any help or support, reach out to our International Advisory Council Chairperson, Dr. Rafi. IRIOSH will do best to hear your stories and try to support you or guide you in the right directions if it is something beyond the capacity of IRIOSH. Visit www.iriosh.org and fill out the contact form or use WhatsApp number there. If you want to collaborate with us on projects, seminars, research that align with our mission, vision, and values on the issues of sustainability or public health or workplace health and safety, and psychosocial issues, of course. If you need not-for-profit, independent, professional, or academic guidance on your research project or thesis, Visit IRIOSH.org and fill out the contact form or use WhatsApp number there. If you want to share your research project or article and publish with us, please visit our website and use the contact WhatsApp number there, if any. If you want to join the team of global researchers and volunteers and want to support others to grow who need the most, making a difference in their lives and communities, IRIOSH will be more than happy to welcome you in the family. Please visit IRIOSH.org and fill out the contact form or use WhatsApp number there to connect with us. With that housekeeping, on behalf of the IRIOSH, it is my privilege to welcome you to this inaugural IRIOSH Global Occupational Safety and Health Forum 2026. So my title is Advancing Psychosocial Safety for a Decent Work Future. This presentation is primarily inspired with the ILO Safety Day 2026 report and the real life experience of co-living with the people who are potentially suffering from the psychosocial issues in the communities. Before beginning, I would like to briefly outline this presentation's table of content. I will first discuss why psychosocial safety matters for a global occupational safety and health perspective. I will then briefly explore how technological and organizational transformations are reshaping work environments. Next, I will provide independent reflections on the current evidence and identify areas requiring further attention, including hidden burdens and global evidence gaps. Finally, I will conclude with the practical recommendations and a shared call for global actions toward healthier and more dignified workplaces and communities and families for all. Let's do a real story. Let's hear it. Enough of the theoretical research that may not impact or touch any human life, but may look good on the piece of paper. This story is of a 22 years old young dad has a drug issue, alcohol issue, child custody issue, fighting with the divorce at the same time. Only 22 years old. Lives paycheck to paycheck. You know that if you do not hire him, if he doesn't have a job, he will not be able to feed his 1-year-old kid. If you hire them, you are introducing a different level of risk at the workplace. What would you do? Let's watch this story.
I got strong people like you guys in my life now. So I never had them. I was always alone, trying to protect my mom, trying to protect other people. And boss man made me realize that too when he told me that. He acknowledged my mom. He was truthful. And I was very truthful about how he runs this company. He's a really good man, He does a lot for a lot of people here, and a lot of people don't understand that. And I want to make a lot of people understand that too. But I'm also not going to do it hatefully. I'm going to do it. I want to do it right. I got to do it right. Because I've been doing everything so wrong. My life's been so wrong lately. Just not so wrong. But I want to do it right. I want something for myself. My brother died right in front of me. Saved my life though. That's the thing. He saved my life. People told me he saved your life and there's no reason why he did that. Now I found out why. I had to go through it all to understand a lot more. That's the only reason. I don't blame or I don't judge anybody that drinks or anything. And I used to be that person that's, why do you drink? Why do you do drugs? But now I understand. It's the life that they've lived, you know. A lot of people live the hard lives, but they don't show it, you know. That's how I was doing around here. I seen it. I wasn't able to keep myself, but I'm myself again. I feel like I am. This was me when I was younger. I just had to stop hiding. I got strong people like
So that's the real story. If 60% of the population struggles with the chronic health issues or the mental health issues, what does that tell us? Every other person you are trying to hire in the workplaces, or who goes to the workplaces, or is in the workplaces, is struggling with this psychosocial hazards, psychosocial risk. It is the issue of sustainability, systems issue. What gets measured, what gets managed. Recent global estimates introduced by the International Labour Organization's ILO suggest that the psychosocial risk factors contribute to approximately 840,000 deaths annually, nearly 45 million disability-adjusted life years, and approximately 1.37% of the global GDP losses every year. These findings are important, critical, because they shift the psychosocial health discussions from individual wellness conversation toward measurable occupational safety and health outcomes. But remember, he is not only the member of the workplace, but the member of the community too, your community. This is increasingly becoming a systems issue rather than solely an individual issue. What do you think? So challenges. The world of work is changing rapidly. It's an agile world. Have you guys heard that AI will create more millionaires in the next 5 years than the internet did in the last 20 years? Time will tell. But what we know now is that our current working environment or the operations has been increasingly influenced with the applications of technology and AI. While these latest development and design of workplaces environment may improve productivity, flexibility to some extent, they may also create or introduce new psychosocial exposures that traditional occupational safety systems were not originally designed to address. That's the challenge for you as a policymaker, regulators, and challenge for workers, community members, and communities as a whole. Let's get back to the ILO's report again. The Safety 2026 report represents an important advancement. Brings some information from the site, different regions, different part of the world, rather than framing psychosocial health solely as an individual mental health issue. It recognizes the work design and organizational systems strongly influence worker outcomes. Again, don't forget, workers are the members of the community. I've been keep reminding you that. Its three-level framework considers the job itself, how work is managed and organized, and broader workplace systems. From an occupational health perspective, this prevention-oriented systems approach is an important approach or strength. current challenges another. An independent reflections from IRIOSH concerns the scope of existing estimates. That estimate, remember, 840,000 deaths annual. Current burden calculations focus on 5 psychosocial factors only. It ignores every other possible variables. Only 5 factors: job strain, effort reward imbalance, job insecurity, long working hours, and workplace bullying. However, emerging workplace realities may involve additional exposures such as moral injury, algorithmic management pressures, migration-related stress, traumatic work experience, climate-related occupational uncertainty. How about the geopolitical tussle or tension or conflict between the regions? Therefore, the current burden estimates may potentially be conservative, very conservative. Future research may reveal an even larger global burden. So the ILO's report itself recognizes the challenges related to uneven global evidence and data coverage. It raises an important question: whose experience remain invisible? Did ILO's report capture that person's story we heard earlier, who was struggling with in-person life, struggling with the child custody, struggling with the divorce, mental health, drug, alcohol, and at the same time, if he doesn't come to work, doesn't get a job, he will struggle with hand to mouth, who lives paycheck to paycheck. It could be one of us, students as well. We struggle to pay the tuition, trying to find a job, trying to do the assignment at the same time, research load at the postdoc, at the professors, universities. It could be anybody. So large populations, including informal workers, migrant populations, workers in small enterprises, many low-income regions, remain difficult to capture through existing surveillance system. So the global evidence should continue expanding toward broader inclusiveness. Again, what gets measured gets done. If we do not measure them, we are leaving them behind from the solution. So, from the IRIOSH point of view, what can we do about it? So, moving forward, solutions require shared responsibility. Governments should strengthen psychosocial surveillance and policy frameworks. Employer should integrate psychosocial hazards directly into occupational safety management system. Researchers like you and us should prioritize longitudinal and cross-regional evidence generations. International institutions should support implementation capacity, particularly within smaller enterprises and lower resource settings. At IRIOSH, we believe sustainable progress requires evidence, evidence, and evidence, implementation capacity, and international collaboration. So finally, as we conclude, psychosocial environments should not be viewed as workplace luxuries or issues only. Families, communities, educators, professors, and social institutions all influence worker well-being one way or another, directly or indirectly. Healthy workplaces help create healthy homes, and healthy communities support healthier workplaces. It works both ways. They represent public health priorities, economic investments as well, and commitments to human dignity and social justice. If the future of the work continues changing, our system of protecting workers and the community members family members must evolve as well. I leave you with this thought. The future of decent work will not be defined only by safer machines, safer PPEs, but by the healthier human beings. Committee members, thank you.